I have something special for you in this video. The Holy Grail for joint and arthritis pain. Maybe. Let's get into it. I'm not a doctor, and this is for informational purposes only. Let me just say, you fitness folks have a lot of passion. I think that's great. Slamming me in the comments section. Let me ease your heartburn. This channel only occasionally focuses on fitness and health. I heard you guys and gals are pretty cutthroat over there in the fitness side of things. You don't have to worry about another guru in this space. However, I do have 26 years in the game, and I'll just leave it at that. So, also, someone asked, why do you play music in your videos? Listening to music that matches your mood, can also be helpful in releasing emotional tension. Music's my life. Music triggers powerful positive emotions via autobiographical memories, ladies and gentlemen. It can also reduce your heart rate, lower blood pressure, decrease your cortisol levels. Like when you work out, your cortisol levels go up, your stress hormone levels increase serotonin, and endorphin levels in the blood. It elevates your mood. Music can boost the brain's production of dopamine. So I think for me, without music, I'd be a lost soul. So I'm going to put it in my videos, and I don't care what anyone thinks because I'm just doing this for me. And if it helps people out, that's fantastic. So, all right, ladies and gentlemen, I got the Holy Grail for you, and not many people have heard of this. Adequan might be the Holy Grail for joint and arthritis health. I'm gonna guess that you haven't. Not many of you heard of it, and I heard about it from my personal physician in Europe and a top 12 strongman that I used to train with occasionally when I lived in Europe. So let's get into it. I think it's a very special product. Adequan is made by Loophole Pharmaceuticals. In the U.S., it's resold by vet suppliers and comes in 3 versions. There's a version for dogs, the Adequan Canine, and 2 for horses, Adequan Equine for IM injection, and Adequan Equine for injection directly into the joint. I wouldn't recommend that. The equine version comes in single-use 5 ml vials designed for injection all at once. The canine version is the same as IM, but comes in 5 ml multi-dose vials and has roughly 0.9% benzyl alcohol added to prolong, the sterile shelf life. So they all require a prescription from your vet, like I said, for human use in Europe. So it's also sold in Europe under the trade name Artopreneur. Presently, FDA has not approved it for human use in the USA, but a lot of people are using the vet versions for themselves. And there's a lot of data. If you read stories of individuals online who've taken it, you know where to look. So why is it not approved in the U.S.? Given that Adequan was approved in the mid-1980s and that Legend was approved not too long thereafter, there's certainly been plenty of time to get products approved for use in human medicine. There's a lot of empirical data, but they're not. And for my way of thinking, there are only a few options of why that is. I know how this game is played with the FDA and getting approval of products for 10 years. So, number one, the product can't be shown to work in humans. It's already approved for human use in Europe, so that's not true. The manufacturers have other things. Maybe, some people are saying maybe the manufacturers have other things to do besides rake in buckets of money that would come to them should such products actually work. Maybe rather than spending the necessary time indoors doing laboratory statistical analysis, they'd rather be at the beach hiking or wine tasting, and walking down a nice trail. So that's a possibility. Number 2, there's a conspiracy being directed by the Deep Arthritis State, the DAS, to prevent these drugs from ever coming to market, so that the DAS can continue to not really help people with our arthritis and joint problems and make more money. So wait, they'd be able to sell the drugs to people too. Maybe that this isn't such a good choice. But remember, ladies and gentlemen, companies make more money treating people than curing them. And this product not only reduces pain, but regenerates tissue in the joints. It's very interesting. So number 3, maybe the lab folks are lazy. Granted, this would be over 3 decades of lazy since the 80s, and most lab folks that I've met are anything but lazy, but I've known to want to stay on the couch too sometimes, but they got a lot of bureaucratic red tape to get through the process of getting these drugs approved. So the bottom line, however, is that these products got approved for a very different process than the process that is used to approve for human drugs. We all know the vet process is different. It's certainly less stringent, and whether that's a good thing or not is, obviously debatable. But once again, it is approved for human use in Europe. When we talk about it, I think it's a very special product, and we can look at the specific mechanism of action is not known of Adequan, but it's been shown to help keep the cartilage. It's been shown to help keep the cartilage healthy and intact, so the bone in the joint cannot touch each other. So let's talk about the dosing, and we'll start with animals. So the recommended dose for dogs is 2 milligrams per pound of body weight twice weekly for up to 4 weeks. Another way to figure it out is 1 ml per 50 pounds of body weight, twice weekly for 8-week injections. For horses, it's 500 milligrams twice a week. So to gauge a human dose, it's plausible to pick something in between or roughly close. And from talking to people in my own experience, I've used the product for 9 years. Personally, I take 500 milligrams every 5th day. I've heard people take 200 to 300 milligrams twice a week, and some take 100 milligrams per day. So I take 500 milligrams. There's an initial 4-week treatment period, and then a maintenance injection once a month at the same dose is common. I take a full bottle of 500 milligrams every 5th day for 3 to 4 months. And I'm telling you, it's unbelievable. So what is Adequan? Adequan belongs to a class of drugs called disease-modifying osteoarthritis drugs. So DMOAD. It is the only FDA-approved product of its type in this class, and has been clinically shown to help treat arthritis while simultaneously relieving joint pain. So Adequan is a prescription medication that can only be dispensed and administered by a licensed veterinarian in the United States. That's because it isn't just a pill or an ointment, but a treatment requiring injection. A little more stringent over here than Europe. So when injected directly into your dog's muscle, we'll say Adequan. Here's the name on the generic, the name on the chart here. It basically inhabits bad enzymes that break down cartilage in your dog's joints. And it's been shown to replicate that in humans as well. So first, Adequan has important anti-inflammatory effects. So it is able to provide relief from the symptoms of joint damage, heat, swelling, pain, and lameness. And Adequan can be found in the synovial fluid at full therapeutic levels within only 2 hours after intramuscular injection. So fast uptake, and also Adequan is a product with potent ability to block the action of destructive enzymes that threaten to perpetuate the joint inflammation and attack the cartilage and break down the synovial fluid. This stuff is the bomb. So number 2, second, Adequan also stimulates the synovial membrane to manufacture new viscous synovial fluid to replace the thin fluid that was produced when the joint became injured. So by improving this fluid, Adequan helps the joint, the actual joint, regain its ability to lubricate and guard itself against further inflammation and help reestablish nutrition to that cartilage. That's absolutely epic. And Adequan attaches itself to the damaged cartilage, where it has a positive effect on cartilage metabolism. So this should favor the cartilage. When you look at the data, it should favor the cartilage repair process, actually help heal that cartilage. So Adequan is the only joint treatment proven to reduce the inflammation and pain of degenerative joint disease, but also to help stop the degenerative process. Did you hear that? Also to help stop the degenerative process while stimulating the production of new joint fluid and new cartilage. So you are no longer just treating the symptoms, ladies and gentlemen, you're doing something to help stop the degenerative process. So now you're, well, Tim, you're talking about dogs and cats and horses. No. So, I mean, just one guy who used it to fix his shoulder stated, and you can find this on the internet, somehow this Adequan acts like a catalyst in the matrix within the cell body itself and speeds the production of collagenous fibers and synovial fluid. The results, in his opinion, are amazing. New joints, not just something to mask the pain, actually heals the cartilage. So when we talk about what are the side effects of Adequan? Virtually nothing. The most common reported side effects were mild pain or swelling at the injection site, whatever, diarrhea, dose-related, and delayed blood clotting, like taking an aspirin. And it did not require treatment if they ran into these problems. So in my opinion, ladies and gentlemen, if you are searching for a product that treats both the symptoms and the underlying degenerative disease process, and you can see it in some of the human trials, people taking it, it's been proven in canines and horses, Adequan may be a good choice for you. You know, there's a lot of, it's considered off-label. There's a lot of people that, you know, I'm not a doctor, this is for informational purposes only. But I do a lot of studying on this stuff, and I worked in the pharmaceutical sector. And I will say this, not a lot of doctors know about these things. They're not versed in supplementation, and there's a lot of people on the internet that are more versed in this stuff. So what can I say? I know 12 plus people that have taken this for human use. My doctor is in Europe. He is a MD. He's a sports neurologist and certified in homeopathic supplementation. He's a nutritionist, and he trains Olympians. And I met him over 11 years ago, and he trained me, okay, when I lived in Madrid. Longer than that ago, and then I met him again when I was out there. But that's when he started talking to me about all this stuff about 11 years ago. And I worked out with a strongman in the gym in Madrid who took buckets of this stuff and swore by it. Because these guys go through a tremendous amount of pain and the weights they lift, you know, these strong men. And he swore by it, and I did more research on it and talked to more people and read more articles of people online, and this doctor swore by it. So we're not just talking masking pain. We're talking, you know, for example, my doctor friend in California said after 3 weeks on it, in the shower, his shoulder pain went away. I can tell you I had tendonitis in my knees. That's the only problem I ever really had. I took this stuff after 6 weeks, it was gone. It was gone. And I went off, and it was still gone. So it takes a little while to amp up, in my opinion. You'll see online some people say don't bother, try to get the horse version. And others will say the canine version works just fine. But I suggest talk to your doctor, you know, your cutting edge doctor, read about it online. I'm not a doctor, for informational purposes only. But for preventative, you know, when you lift weights, if you're a runner, put a lot of stress on your body, I think this might be a nice preventative avenue that you might want to consider. I've never had any major problems. I mentioned all the other things that I do for inflammation in the body. This is one of them, and I've been doing this for 9 years. And I take it once a year for 3 or 4 months. And your joints are very delicate. If you lift weights and do weight-bearing exercises, it's very stressful on your body. And this might be something that will work for you. There's not a lot of, I don't see a lot of videos on it online. There's not a lot of chatter about it. I think it's still underground, but there's a lot of data on it, a lot of empirical data, and there's a lot of athletes who put it into their protocols. And like I said, I've personally put it into my protocol, but I've never had a serious injury. And then I went on Adequan. I always took it early when I was feeling fine for preventative, but I first took it when I had tendonitis, and I took it, and after 6 weeks, it went away. So every 4th or 5th day, I take 500 milligrams, and I take it for 3 months, and then I go off. So Adequan, look into it. I'll leave some information in the description. There's a lot of clinical data interactions, but you know, a lot of vet medicine is used for human use as well. So that's nothing new. A lot of stuff is taken off label. B12 is B12, for example, for vet use. If you take it for human use, ascorbic acid, vitamin C, for vet use. I take it for human use. So it's something you want to use in your protocol. I think it's a great product to extend your life and your joints, which is important because you run into a lot of problems still in this day and age with joint replacements and knee replacements and hip replacements. There's still not a lot of 100%. Why not try to save what you currently got? Adequan, look into it. Take care.